Dear viewers, today we will talk about the prevention strategies in football in particular, but it relies also on sport in general. My name is Dvorak. I am professor of neurology, experts in spine disorders and sports medicine, working at the Schultes Clinic in Zurich since 30 years. I was for 23 years a FIFA Chief Medical Officer and created the Medical Assessment and Research Center, which resulted approximately 430 original papers related to football medicine. So today we have decided to speak about prevention strategies. 11 players. So it was very logical that we have used the number 11 as synonym for prevention. 11 plus to prevent injuries, a prevention program. 11 steps to prevent sudden cardiac death with the CPR 11. 11 rules to prevent doping. And finally, 11 for health to prevent any disease in the society. And maybe in the future we will launch a new project, new program, 11 Action to secure post-professional life. When we talk about the present and future of sport or football medicine, we have to consider the health and in particular the quality of life of the athletes, which must always be our prime concern. We have experienced in the past that philosophical approach will not convince the executives for change. We have to take the lead, we, medical professionals, and learn from our past mistakes to do it better in future. It is very clear that ignoring scientific evidence is unethical and knowledge oblige. As a headline or take-home message, physical activity and prevention is the key for quality of life. So why injury prevention to start with? We have football-related injuries caused by contact with another player or non-contact injuries. The contact injury is very difficult to prevent because that's a philosophical approach and attitude towards fair play. But we can influence and impact the non-contact injuries by preventive program. Over the past 15 years, we have developed the 11 plus prevention program, a complete warm-up program which you can perform with your team within 20 minutes at most, and it's divided in different exercises. So keep in mind 11 plus. Part 1, running exercises with different level of performance. Part 2 are the preventive exercises focused in particular to muscle groups which are prone to injuries. Number 1, definitely the hamstrings, which would be the Nordic hamstrings, which should be done regularly in every warm-up. And finally, part 3, rounding up with running exercises. Complete warm-up program 11 plus, which has been now distributed and is exercised all around the world, translated to a number of languages, including your language. So you have the access to all the educational materials with instructional videos. And it's very happy to see that even the women football under the leadership of Dr. Zore Harakian is regularly performing the 11 plus to reduce the injuries. So continue in this respect. In the past, we have used the major sporting events such as World Cup at the different levels and age groups and genders to promote the preventive programs. Here you see the promotion on the LED bands during the World Cup 2014 in Brazil. This is on one side, but to convince you to do it, we have to offer you scientific evidence and facts. 3 major studies, international studies, has been performed. The first one in Norway with women footballers, divided into 2 groups, randomized. 125 teams with totally 2,500 women football players in intervention group, performing regularly twice a week the 11+, and a control group. Finally, we have analyzed 52 teams in the intervention group and 41 teams in the control group. The results have been published in the British Medical Journal, a highly ranked scientific journal, and the results, to sum up, very straightforward. If you do the 11+, you will have a 37% less injuries occurring during training and 29% less injuries occurring during the match. So overall, 1/3 less injuries. That has impact. The next study we have done in the United States, mainly in California, with the Athletic Association, with men's soccer team. Again, randomized in the age between 18 to 24 in 34 control teams, close to 1,000 players, and 27 intervention teams, close to 800 players, during one season. The results, again, very straightforward. Up to 52% less injuries. In particular, the severe injuries such as hamstring, partial or complete rupture, ACL, anterior cruciate ligament ruptures, reduced by 50%. But also other groin, head injuries, knee injuries, ankle injuries, and so on. So overall, again, a significant reduction of injuries in men football teams. ACL, one of the most detrimental injuries in football, we had in the intervention group only 3, while in the control group there were 16 ACL injuries during one season. We published the results in the American Journal of Sports Medicine 2 years ago, so the details can be read there. Again, very highly ranked scientific journal. The third study, we have women, men, and now children. Very often, children is a neglected football population. So we have looked in a multi-center, cluster, randomized control study in 4 countries: Switzerland, Germany, Holland, and Czech Republic, my home country, stratified them on the club level, again into the control group and intervention group, which performed an adaptive program 11+ for children as a routine warm-up twice per week. The injuries have been documented by the athletic trainer or the physicians in the villages or who were related to the clubs. This is the first study, to our knowledge, to analyze injury prevention in organized children's sport. Without going into the details, again, the results are already published in the SportsMed 2015. Severe injuries in children reduced by 50%. We think that the prevention effect in children might be related to the improvement of motor performance, and of course depends very strongly on the compliance. Meanwhile, more than 40 papers have been published on the efficacy of the 11 Plus program for the different groups. For the intervention, 4 randomized clinical trials, they are the most valuable. For the performance, which clearly shows the increased or improved performance, again in a randomized clinical trial. The healthcare costs are definitely going significantly down, and it's obvious you don't get injured, you have no costs. And 4 studies on the delivery methods. To keep it really in mind, and this is very obvious from those 2 graphs, if you perform regularly the 11 Plus, you have significantly less injuries if you don't do. And that's obvious. If you don't do anything preventive, you will have no effect. But we have a very clear proof for women, men, and the children as well. So the key for successful prevention of injuries in football, it should be regularly performed, and I encourage you to do it twice a week, 15 to 20 minutes as a part of your routine warm-up. If you do it more often, basically even some of the exercises at home, routinely like brushing the teeth 3 times a day, then you will have a better effect. The goal is to have a warm-up as routine. And first target when you start are of course the coaches. You have to convince the coaches that this is good for them and for their team. And very often coaches say, well, I have done it for years and years in that way, no need to change. But we have the proof that even those who think they have the best program, the team are improving with 11 Plus. In a recently published review paper by completely independent research group in Denmark, independent from our research group, came in conclusion and published in the British Journal of Sports Medicine that there is a significant effect of specific exercise-based football injury prevention program on the overall rate of injuries in football. This systematic review, following the stringent rules of systematic review and the meta-analysis, proved 11 Plus is effective. So in summary, we have 35% less injuries in women and 50% less injuries in men and children. How to implement? We have published jointly with my co-authors Mario Bizzini, Dr. Mario Bizzini, who is the driving force behind the 11 Plus, and Astrid Junger, the former head of the research of the medical assessment and research centers. Take-home message for the 11 Plus. All get benefit. It's a basic injury prevention program, for sure can be improved. The reduction of non-contact injuries up to 50%, cost reduction, and if you start to implement, follow the implementation of the 11 Plus, which are published in the previous article I have shown to you. Coaching education throughout the country as a regular part of a routine coaching education. And of course, you have to maintain. And what even more important for the future, you can share your experience with other sports such as handball, basketball, volleyball, rugby, and others. Next subject I will very briefly touch are the head injuries. Obviously here you have seen clear concussion. The player is unconscious. The doctor comes, check the player, and come to the conclusion the player has to be exchanged. But the decision of the doctor has been overruled by the player and by the coach. The player is returning to the game. This is fundamentally wrong. We have worked on the concussion and return to play with top experts from around the world over the past 15 years. And the most recent publication from the International Consensus Meeting in Berlin 2016 has been recently published. We came to the conclusion, and this was pushed already through the International Football Association Board, the supreme rule maker in football, that if there is a suspicion of concussion, that 3 minutes examination on the pitch as a screening should be allowed. The match is interrupted by the referee on the order of the doctor, and for 3 minutes the doctor has time to make the first assessment on the pitch and make the decision in return to play, or remove the player from the play, refer to the hospital for the further examination. So the most recent consensus statement of the Concussion in Sport group, which I am member of, provide a cornerstone for the decision making if concussion is confirmed and or even suspected. Video replay for decision is crucial and should be implemented and strongly recommended from our medical profession. 11 steps to prevent sudden cardiac death. I refer you to the CPR 11, providing the comprehensive information what should be done if you are confronted with sudden cardiac arrest on the pitch. No doubt, there should be an automated external defibrillator on the sideline at every playing ground to be ready for action if needed. And keep in mind, if you suspect or if you see a player going down without contact with other player and is unconscious, then it's sudden cardiac arrest. And as we have learned from our teacher, Professor Ephraim Kramer from South Africa, Johannesburg, you have 120 seconds to apply the shock with the external defibrillator, and that saves life. So keep in mind, go on the web, go to the apps, maybe translate into your language and use it, and make sure that you have the defibrillators on the sideline of the pitch. Finally, and this is my most favorite subject, football or sport in general is medicine. We have worked for the past 14 years with more than 150 researchers from 15 countries to have scientific evidence that physical activity or playing regularly football twice a week, 30 minutes, that this will have impact on your quality of life and also on your health. Today we know that the blood pressure is going down, that the blood sugar is going down, that your heart rate and the heart function will improve, and other variables. And this is true for children, for adolescents, for adults, and also for the aging population. After more than 14 years of research, with testing of approximately 21,000 participants in different ages, and published 125 original papers in 40 peer-reviewed journals, we can say, yes, football or sport in general will improve your physical fitness and health for hypertensive men, for type 2 diabetes, for men and women, for hypertensive women, for prostate cancer, and basically for many other diseases. And just to give you the take-home message. As 70 years old, trained, and soon I will be belonging to this age group, are as healthy as 30-year-old who don't train. So you can keep your physical activity, and you will also have impact on your mental health, of your mental performance if you regularly train. So please keep it in mind and follow this path. This is my final slide. For this, what I have shared with you, the information, it's just a review of some of the major milestone publications. Between 2000 and 2017, we have published altogether 434 publications related to the subject. And if you want, and you have the idea, you can follow me also on my Twitter. So I will share with you in future also the most recent informations and development in football medicine. Thank you for your support, and also thank you that we keep in collaboration in the future activities, and have a great meeting in Tehran. Thank you.